To register your practice for a QOPI Round, go to https://mycopi.asco.org/registration/login.aspx. On this screen, you'll enter your QOPI username, your password, and the CAPTCHA information. Then click Login. The first step is to go through these 4 tiles, starting with practice information. Review your practice tile information. If you're registering for the first time, you'll have to input information for each of these sections. If this is not your first time registering for a QOPI Round, you'll review all of these sections to make sure no information has changed. Starting on the basic demographic tile, all of this information will be auto-filled by the system. Then you will select your types of care. Please select all types of care that your practice sees, even if you don't plan on abstracting for one of them at this time, because this will affect your ability to register for modules and tracks. These can be changed at any time if you realize that you've missed one or you no longer see a certain patient type. You can just log back in here and select or deselect any of these options. Only MOXIE participants should click yes here. Only IASLC participants should click here. After you've reviewed this information, you can click Save and Proceed to Primary Contacts. This information should be auto-filled from when you first entered the PHC or corresponding physician information, as well as the QOPI Program Administrator or PRA information. But if you need to update it at any time, you can come back to this screen. When you're done reviewing and or entering this information, click Save and Proceed to Program Administrator, which will take you to the information for the Program Administrator. Once you're done entering or reviewing that information, click Save and Proceed to Affiliations. This tab provides information on the affiliation of your practice. Select the appropriate answer here. If you need more information on what a term means, you can hover over the blue eye icon and a pop-up bubble will appear with more details. Once you've entered this information, click Save and Proceed to Patient Characteristics. This tab collects estimates on how many patients and what kind of patients you see each year. Once you're done with that, click Save and Proceed to Clinical Trials. If your practice is involved in clinical trials, please fill out the information here. If your practice does not participate in clinical trials, click Not Applicable. When done, click Save and Proceed to Staffing and Patient Services. This tab is important because the numbers entered for total hematologist oncologist, total medical oncologist, and total medical hematologist oncologist will determine how many charts your practice is required to abstract. Total practice NPIs will be filled in automatically by the system, so you don't have to worry about that. You should enter any of your providers who are hematologists oncologists in this space, and then calculate based off that number how many FTE equivalents you have. Then enter your providers who are only medical oncologists, not hematologist oncologists, and do the same thing to calculate their FTE numbers here. Then lastly, if any of your providers are both medical and hematologist oncologists, enter them in this field here. And then finally calculate their FTE equivalents. The rest of the staffing and patient service information is required, but does not ultimately affect the number of charts your practice is required to abstract. Once you've finished all of that information, click Save and Proceed to practice outpatient and chemotherapy facilities, and enter the relevant information here. After that, click Save and Proceed to EMR system, and select the EMR that your practice currently works with. Then click Save and Proceed to Health Plan Program. This information mostly applies to domestic U.S. practices, as you can select any of the health plans that you currently participate in. Therefore, if the health plan asks QOPI if you are a participant, QOPI can confirm that you do in fact participate with QOPI. Last, click Save and Proceed to CLQ attestation. This tab is only for practices who are currently participating in CancerLink for QOPI certification. That will be a very small number of our practices. If you have more questions about that, please feel free to email qopi@asco.org. Next, to site. You are only required to enter site information if you're going to be abstracting for multiple sites within your practice, or if you are going to be participating for QOPI certification, then you will ultimately need to add your sites here as well. But if you're not participating for QOPI certification and only going to abstract for either your practice as a whole, or you only have one site, there's no need to input this information. To add the information, you'll go through most of the same information we just went through for the practice, but answer site specific. Once you've completed all of that information, click Proceed to Legal Agreements. If you've signed agreements previously, they will show up in the legal agreement table. If you have active agreements currently, they'll show up in green, and any previous and now void agreements will show up as In order to select the agreements that you need to sign, click this dropdown, and the QOPI BAA and QOPI Participation Agreement will show up. Both of these agreements need to be signed in order to proceed to round registration. We're going to select the QOPI BAA. These two buttons say re-sign now because I'm re-signing this agreement. We already have an active one down here in the system. If you've never signed agreements with QOPI before, the button will read Sign Now and Sign Later. You should select Sign Now if you are authorized to sign this legal agreement and want to do so right now. If you are not authorized to sign this legal agreement, please select Re-Sign Later or Sign Later and enter the email address of whoever at your practice is authorized to sign legal agreements. That will generate an email to that person and walk them through the process of signing the agreement. We're going to review signing now. This pop-up will appear if you already have signed agreements within the system, letting you know that going forward will void the previous agreement. Only click this if you are going through the process of actually signing the agreement. If you accidentally click this and void your previous agreement, you'll have to sign another one regardless. Once you click OK, the system will generate a new agreement for you, and it will appear at the bottom of the page. Once you've reviewed the entire agreement, your practice name will show up, your address will show up, the date will show up, and you're able to type your signature and input whatever email you need to. Then you'll click Sign. And the agreement will now be signed. You will have to click the refresh button over here in order for the new agreement to populate in this table. It may take a minute. And here we have our new QOPI BAA agreement. Next, you'll complete the exact same process with the QOPI participation agreement. Once both agreements are signed, you'll be able to select Proceed to QOPI Round participation. If you are registering for the first time for a round, there will be one additional screen before this participation detail screen that asks if you would like to participate in either a QOPI Round or QOPI Flex. Most practices participating with QOPI will participate in a QOPI Round. That's anyone doing QOPI certification or recertification who does not need an expedited quality score, anyone participating in a standard QOPI round, or anyone doing a maintenance of certification round. If you need to have an expedited overall quality score for your QOPI certification, then you should select QOPI Flex. Or if you're interested in participating in ad hoc measures, which is a feature that allows you to participate in just a couple of measures if you're doing a targeted quality improvement project rather than an entire module, then you can also select the QOPI Flex option. If you participate in QOPI Flex, you will not receive the aggregate QOPI data at the end of the round to compare your scores to. So that is why we suggest that most practices participate in the QOPI round. This will be especially true for our international practices. Please select QOPI Round. If you have any questions, please email qopi@asco.org. After you've selected QOPI Round, you'll come to this screen where it says Participation Details. You'll be able to select your participation type as either practice or site. If you are going for QOPI certification, you select practice. If you are reporting, if you're planning to participate so that all of your sites get one report, then you'll click practice as well. If you are a site that's part of a practice and you plan to participate differently than other sites within that practice, that's when you'll click site. Once you've selected practice versus site, you will click this box to confirm that all the information that you just reviewed on the practice and site tiles is correct, and then you'll be able to start selecting your modules and tracks for registration. In order to select your tracks and modules, click Start, which will open up the round settings page. So on participation, you're able to select for your future round participation, yes or no. Select yes if you're participating in QOPI in future years. This will keep your legal agreements active. And then select the future round that you plan to participate in. This will always be 1 year in advance. Your total FTE field will be auto-populated by the system based off the information you input on your Staffing and Patient Services tab. If this number does not look correct, please review your practice information and Patient Services tab. Next, selecting your participation for. If you plan to go for QOPI certification and plan to participate in the QOPI certification track for the first time, or if you're not already certified, click QOPI certification. If you are currently QOPI certified and it's time to recertify by participating in the QOPI certification track, click QOPI recertification. If you're currently certified and this is a maintenance round for QOPI certification, click Maintain QOPI certification status. If you are not planning to go for QOPI certification and are not currently QOPI certified, click QOPI participation. Lastly, the ad hoc measures are only available if you're participating in QOPI Flex, so this will default to no and you cannot change it unless you're participating in QOPI Flex. Again, if you have more questions on QOPI Flex, please email QOPI@asco.org. When you've filled in all the information, click Save. Then the system will take you to the Tracks tab. For our practices participating for QOPI certification, the only abstraction requirement is to participate in the QOPI certification track. If you click on the name of the track, it will list out the measures that you'll be participating in, and you'll notice that you're unable to deselect any of them. All of these measures are required, but they're the only requirement. You're certainly welcome to select additional tracks or modules, which I'll show you on the next screen, but you're only required to participate in the QOPI certification track. You'll also notice that if you selected QOPI certification or QOPI recertification on your participation type, the QOPI certification track will be automatically selected for you. Once you're done on the Tracks tab, click Save. And this will bring up the Modules tab. Again, if you are participating for QOPI certification, you are not required to select any modules here, but you're welcome to if you would like to participate in additional abstraction. It will be more work. We don't necessarily recommend it, especially for a practice certifying for the first time, but you're welcome to select as many of these as you would like. Once you've selected anything you're interested in, click Save, and this will take you to Test Measures. For practices participating in QOPI certification track as of round 2, 2020, the symptom test measures here will be, you cannot deselect them as they are a part of the QOPI certification track. These are two new measures, but only new in the sense that they are slightly rewritten from previous antiemetic measures that we had that used to be included as part of the QOPI certification track. If you've selected any other modules, those will also be listed here. Again, test measures are always optional, except for these two symptom test measures for QOPI certification. Last, you'll click Save and Finish. And you're able to click here on Details and review how you're participating and what tracks and modules you've selected. Again, as of round 2, 2020, the QOPI certification track has 27 modules, 2 of which are considered test measures. So if you're looking to participate for QOPI certification, your registration should look just like this. One element that's not seen here, because this is a test practice, there will be a button right here that says Submit Round Registration. You must click that before you're able to begin your abstraction. Once you click it, you'll receive an email that says thank you for submitting your round registration, and then you'll be able to go on to the QOPI dashboard review and the chart submission. To access the QOPI dashboard, go to https://myqopi.asco.org/dashboard/login.aspx. Here, you'll enter the username and password that you've been provided by QOPI and the password that you've set up. Then enter the CAPTCHA information and click Login. Please note this is a different website than the registration website. QOPI staff sometimes adds reminders or information that is time sensitive and we might not have time to send an email about, such as here final certification reports are available. Please check this spot here for important dates and the most up-to-date round information. Over here on the left side, we have the administration menu. You have your QOPI welcome page. So you'll see the round materials and round trainings. This is the default page when you log in to the QOPI dashboard. Here you'll find all of the materials necessary for abstraction. These change each round, not drastically, but they do change from round to round as our measures change. And then we also have our round trainings here that encompass a couple of different things. These are generally round specific rather than platform general information. The next tab is key dates and announcements. We'll always announce dates of interest right here, and we may put up announcements for various programs that we recommend or are part of ASCO. Next, we have the Getting Started and FAQ page. This will be very helpful for our brand new QOPI users. We have several tutorials over here, as well as a full FAQ page here. If you just want a quick answer to something, rather than having to email the QOPI Help Desk or call us, go ahead and look here, and some of our most asked questions have answers. Lastly, we have our international practice information. Anything here for our international practices, any documents specific for our international practices live here. Next, under the QOPI menu, we have QOPI Round. This is where you'll actually access your chart entry. Here is your tile for the current round. Any previous rounds that you've abstracted in will be able to be selected down here. Once you click on the round, if you need to review your round registration, you can do so on this tile. Click Details. It will show you everything that you're registered for. And to get back to that, go up and click Rounds. Click the round tile again. And chart submission is where you'll actually submit your data. We have a separate tutorial that will go over how to actually add charts, but that's where you'll see that information. Additionally, if you are participating for QOPI certification, you'll also have a QOPI certification tile. There's no need to click on it. There's no need to, it's no different than your chart submission if you've only selected the QOPI certification track. When you might see a difference is if you've selected the QOPI certification track and additional modules or tracks. Those will show up here on the chart submission tile, and they won't show up here on the QOPI chart selection, QOPI tile. Lastly, down here we have reports. We have a separate video on going over reports, but that is where those are located. Next, we have QOPI certification. If you are participating for QOPI certification, this is where you will come to fill out your application. They also have a key dates and announcements section, some international practice information, and several program resources. If you need more information on how to go about your QOPI certification application, you can email the QOPI certification team at qopicertification@asco.org. QCDR dashboard will only be available to practices currently participating in the QOPI reporting registry. Administration. This menu is available to anyone who has the PHC or corresponding physician designation and the QOPI practice administrator or PRA designation. This information will not be available to anyone who only has a reports designation or has just a data abstractor designation. First, we'll go into practice. This is where you can edit and review any of your practice information. You'll notice this all looks very similar to when we registered for a round. If you ever need to review any of your information, you can come here and update it all. Site is the same thing. You're able to click on any of your sites or add a new site if you need to. And again, they look very similar to everything that we saw when we registered for the round. Provider is where you will add your providers to the system. Each chart that you enter must be associated with a provider. So you will need to enter all of your provider information for each provider that you will be abstracting charts for. The providers do not need a separate login unless they are entering their charts themselves or if they are going to assist in chart entry. But if you do need to create a login for them, you can just click this box down here, and then you will enter them as a provider here, and they will also receive QOPI credentials. Again, most providers do not have QOPI credentials unless they are entering their own charts. If you need to edit information on any of your existing providers, you can just click their name and edit any of the information here. Just make sure you hit save before you exit out. Last, user management. This is where you're able to add new users, create existing provider login. If you added a provider to the system already and didn't provide them a QOPI login, but they want one now, you can do that here. Otherwise, if you need to update any information, you're able to do that here. The most important field is probably the user role. Data abstractors are the ones who can abstract data into the system. That option is also available to PHCs and PRAs. PHC is the corresponding physician, so that ASCO member that you input the ASCO member ID for at the very beginning. PRA is the QOPI administrator. This person has admin privileges to the system and has ability to do most of the things that need to be done in the QOPI dashboard. And then lastly, reports. So you will not see reports unless you have a reports designation. We get many, many questions during each round about how you can see reports. Even if you are a PHC and a PRA with admin privileges, you won't be able to see reports unless you have a reports designation. The next quality steps page has information about the various quality programs that ASCO provides to its membership. Registration will actually take you to the registration page for registering for a round. You cannot register for a round within the QOPI dashboard. It's actually a separate system. So if you ever need to get there, you can come to your QOPI dashboard, click registration, and this will take you to the round registration page. Lastly, we have our feedback button. There are a couple of ways to provide QOPI feedback and or ask questions. That feedback button will lead you here. You can rate your experience. You can select either the QOPI Quality Oncology Practice Initiative or the QOPI Certification Program. We are two separate programs, but we work very closely with each other. So if you select the wrong one here, our team will pass it on to whoever is the most relevant person to answer your question. But if you have questions about registering for a round or abstracting data or any of your reports, you'll want to select QOPI, the QOPI Quality Oncology Practice Initiative If you have questions about your certification application or your site visit or your policies and procedures or the standards, that's when you'll want to select the QOPI certification program. Another way to contact us is to contact the help desk. That brings up the exact same feedback form. You can also email us at QOPI@ASCO.org. And then lastly, anytime you finish a session, you will want to click Log Out. And that will take you back to the login screen. Lastly, we like to remind our users to use either Google Chrome or Mozilla Firefox as web browsers. A lot of our users who try to use either Internet Explorer or Microsoft Edge experience a lot of issues, either with the sign-in page or actually entering charts. The system is very slow and for whatever reason does not work well in either Internet Explorer or Microsoft Edge. So if at all possible, we encourage our users to use Google Chrome or Mozilla Firefox. This is the end of the QOPI dashboard tour. In order to access reports within the QOPI dashboard, your user role must have a reports designation. If you have more questions about that, you can email QOPI@ASCO.org or look at our FAQ section under reports and find more information about that. When you do have a reports user role, you'll have the option here to select reports. This screen will show up, and then you're able to select any of the reports within this. I'll go over later which reports have which information. Your practice name will show up. You're able to select which cycle, which round you want information for, and then you can click View Report. The reports sometimes take a while to load because some of them contain a lot of information. We do also recommend viewing them in either Google Chrome or Mozilla Firefox. Reports tend to have a lot of trouble coming up in Internet Explorer or Microsoft Edge. When they do show up, you'll notice there's a Save Disk icon up here. You can export your report in a variety of formats. This report is our final certification report. There's no information for this test practice in the system right now, but you'll see that it lists out all of the measures that are included in the certification track. Here, under if your practice has information, it will show the denominator, so how many charts you have that met the denominator for the measure, and then the numerator, how many charts you have that met the numerator for the measure, and then it will give you a percentage of how many charts succeeded on that particular measure. It also provides the QOPI aggregate, so how the average of how everyone else did on that particular measure, and then it will tell you here how you fared, how your practice fared compared to that aggregate. So it will list your percentage there, and if your number is better than the QOPI aggregate, it will show up in green. If it is less than the QOPI aggregate, it will show up in red, and if it's equal to the QOPI aggregate, it will show up in black. To find more information about reports, you can go to the Welcome page and find our Complete Reports Guide right here. This will show you how to access reports, which is just what we went over. It also includes information on how to add a reports user role to anyone. Again, that can only be done by the QOPI administrator or the corresponding physician, but they are able to add reports to any user. Lastly, our most helpful piece here probably is the reports available table. It will actually list out the various reports we have, what information is provided within each report, and has information specific to QOPI certification, which is generally what we get a lot of questions about. If you do have any questions about your reports, either accessing them or interpreting them, you can always email the QOPI Help Desk at qopi@asco.org, and we're happy to help you navigate any information that is provided in your reports.